This medication, Doxepin 6 mg Tablet Hypnotics, is used to treat a certain sleep problem, also known as insomnia. It may help you stay asleep longer and reduce the number of times you awaken during the night. Doxepin belongs to a class of drugs known as tricyclic antidepressants. It is not known exactly how this medication improves sleep, but it may be due to blocking histamine receptors. The recommended daily dosage is determined by your doctor, and it's best to take this medication at the same time each day. Before you start taking Doxepin, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth on an empty stomach, usually once nightly within 30 minutes before bedtime, and do not take it within 3 hours of a meal. Make sure you are able to get a full night of sleep, 7 to 8 hours, before you must be active again before taking this medication. The dosage is based on your medical condition, age, and response to treatment, and should not exceed 6 mg per day. Use this medication regularly at the same time each day to get the most benefit from it, and tell your doctor if your condition lasts or gets worse after 7 to 10 days. Some people may experience drowsiness or nausea when taking this medication. If these effects persist or worsen, it's important to inform your doctor or pharmacist right away. It's essential to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many individuals who use this medication do not experience serious side effects. In rare cases, individuals have engaged in activities such as sleep driving, sleepwalking, preparing/eating food, making phone calls, or having sex while not fully awake after taking Doxepin. They may not remember these events afterwards, which can be dangerous. It's important to contact your doctor immediately if you have experienced any of these activities after taking this medication. The risk of these behaviors is increased if you consume alcohol or other medications that cause drowsiness while taking Doxepin. At higher doses, Doxepin is used to treat conditions such as depression and other mental/mood disorders. It can help prevent suicidal thoughts/attempts and provide other important benefits. However, it's crucial to be aware that a small number of individuals, especially those under the age of 25, may experience worsening depression, other mental/mood symptoms, or suicidal thoughts/attempts when taking antidepressants. It's important to discuss the risks and benefits of antidepressant medication with your doctor, especially for those under 25, even if the treatment is not for a mental/mood condition. Contact your doctor immediately if you notice worsening depression/other psychiatric conditions, unusual behavior changes, or other mental/mood changes. If you experience serious side effects such as eye pain/swelling/redness, widened pupils, or vision changes, seek medical help immediately. While a serious allergic reaction to this drug is rare, it's important to get medical help right away if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not listed here, contact your doctor or pharmacist. In the U.S., you may report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you may report side effects to Health Canada at 1-866-234-2345. Before taking Doxepin, it's important to let your doctor know if you have any allergies to this medication or other similar antidepressants. It's also important to discuss any medical history of urinary problems or a family history of glaucoma with your doctor or pharmacist. Doxepin may cause drowsiness, so it's important to avoid alcohol or marijuana as they can increase this effect. It's also best to avoid driving or using machinery until you are sure you can do so safely. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications you are currently using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, discuss the risks and benefits of using this medication with your doctor. It's important to note that babies born to mothers who have used this drug during the last 3 months of pregnancy may rarely develop withdrawal symptoms, so it's important to notify your doctor if you notice any of these symptoms in your newborn. Doxepin can pass into breast milk and may have undesirable effects on a nursing infant, so it's best to consult your doctor before breastfeeding while using this medication. It's important to be aware of any potential drug interactions that may affect how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. One product that may interact with Doxepin 6 mg tablet hypnotics is cimetidine. Additionally, taking MAO inhibitors with this medication can cause a serious and possibly fatal drug interaction. It's important to avoid taking MAO inhibitors during treatment with this medication, and most MAO inhibitors should not be taken for 2 weeks before and after treatment with this medication. You should also inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, other drugs for sleep or anxiety, muscle relaxants, or antihistamines. Be sure to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. If you have any concerns, don't hesitate to ask your pharmacist about using those products safely. If you or someone else has taken too much Doxepin 6 mg tablet hypnotics and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include extreme drowsiness, hallucinations, fast or irregular heartbeat, fainting, slow or shallow breathing, and seizures. It's important to remember not to share this medication with others. This medication has been prescribed specifically for your current condition, so it's not recommended to use it for other conditions without your doctor's guidance. If your insomnia persists for more than 7 to 10 days, it's important to consult your doctor for further evaluation and possibly undergo medical tests to determine the cause of your sleep problem. As you age, your sleep patterns may naturally change, and you might find yourself waking up multiple times throughout the night. It's a good idea to speak with your doctor or pharmacist about non-medication alternatives to improve your sleep, such as avoiding caffeine and alcohol before bedtime, steering clear of daytime naps, and refraining from going to bed too early each night. If you forget to take a dose of Doxepin 6 mg tablet hypnotics, you can take it as soon as you remember, especially if it's close to bedtime and you're having trouble falling asleep. However, if it's already the next day, just take your next dose at the regular bedtime. It's important not to take a double dose to make up for the missed one. The recommended daily dosage of Doxepin 6 mg tablet hypnotics is typically 6 mg to 10 mg, taken once daily at bedtime. It's best to take it at the same time each night for the best results. Make sure to store this medication at room temperature and keep it away from light and moisture. It's important to store it in a safe place where children and pets cannot reach it. When you no longer need this medication or it has expired, make sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for the best way to do this. Remember not to flush the medication down the toilet or pour it into a drain unless you have been specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.